Hello. For the first question, one key insight I gained from the web seminar was that a single medication can actually treat multiple symptoms or mental health condition. I always thought medication were very specific, like one drug for anxiety, another for depression. But it turns out that many medication act on overlapping brain pathways. This means one drug can improve mood, sleep, anxiety, and even motivation all at once. For the second question is, to put it in my words, I learned that the brain work like a connected system, not in separate parts. So when you take medication, it doesn't just turn off one symptom, it affects different areas of the brain at the same time. This stood out to me because it made me realize how personalized and complex treatment needs to be. It's not about matching a pill to a diagnosis. It's about understanding how that person's brain and symptoms interact. For the third question, this session helped me see that medication don't just treat symptoms, they aim to restore balance in the brain. For example, if someone is struggling with poor sleep and a medication improves that, it might also help with mood and energy levels. Everything in the brain is interconnected, so changes in one area can ripple into others. That was eye-opening for me. For the fourth question, one example that really stood out was about polypharmacy. When a person takes multiple medication at once, sometimes it's necessary, but it also increases the risk of side effects or dangerous interactions like serotonin syndrome. That example made me realize how careful professionals need to be and how important it is for patients to understand what they are taking. The fifth question, webinar also talk about ethical and social issues like patient autonomy, cultural sensitivity, and lifestyle factors. Medication decision shouldn't be based on science. They should be respect the patient backgrounds, values, and preference. I really appreciated this point because it reminded me that mental health care is deeply personal and not just clinical. The sixth question, this ethical and cultural consideration definitely shape how I see medication. I now understand that it's not just technical decision, it's something that should be decided with the patient, not for them. Open communication and respect for their experience are essentially for good care. It makes me more supportive of a collaborative and holistic approach in psychology. For the personal reflection, yes, this session definitely changed how I see medication. Before, I thought it was mostly a last resort used when therapy doesn't work. But now I understand that medication can be a powerful support tool, especially when it's used alongside therapy and other strategies. It helps people stabilize and live more fulfillingly lives. In conclusion, this webinar sparked my interest in how biological, psychological, and social factors all connect in mental health treatment. I'm now more curious about clinical and neuropsychology, especially how different professionals work together to help patients. I want to keep learning about how the brain and behavior interact and how to apply that knowledge in real life care.